And welcome to another segment of Aesthetic Revolution, the podcast. I'm Ed Zimmerman, your host, and I'm assisted by my lovely co-host, Staci Taylor Zimmerman, who hopefully will keep me from diving down some of the rabbit holes today on this interesting topic. It's an oldie but a goodie, pardon the pun, but male menopause or andropause, because it happens.
Just like for women.
Yep. It is a lot like menopause.
So what are some of the symptoms for men? Do they have similar symptoms as women?
You know, the symptoms are not exactly interchangeable, but they are similar. You may notice the usual film derivations, cranky old men or grumpy old men, the titles like that.
Yeah.
And it really is true. It has a lot to do with we all have a shelf life. And as we approach the end of our shelf life, things are happening. Usually hormonally mediated things and things kind of wearing down, but those kinds of things all contribute to menopause. So we see thyroid going down. Thyroid keeps you perky, keeps your brain functioning more adroitly, keeps your reflexes tight. And testosterone is a big one. We see a great reduction in testosterone as men get beyond procreating age. And, that's one of the things that we fight with delivery of bioidentical hormones. So we've talked in other podcasts about all the good things and bad that testosterone can do, but some of the good things are it's a natural antidepressant. No more grumpy old men. Mm-hmm. It maintains bone mass. It maintains muscle mass. It helps maintain erections. It maintains the viability of the spermatogenesis, the sperm production, things like that. So, guys come and they ask questions on our other social media platforms. And, Doc, why is my penis getting smaller? The average male penis, depending on your genetic inheritance and things like that, but the average male penis is probably about 5.5 inches long on stretch or with an erection. It depends. They're showers, they're growers. That's another podcast entirely. Mm-hmm. But the length shrinks up a little bit. There's some contraction of the tissue, or the tissue may be enveloped by the suprapubic fat. So now we've got more than a turtleneck going on. We've got a turtle happening, or even worse, a hidden or buried penis. That's another podcast. That's a fun one there. And the girth of the penis is going down. So you're losing subcutaneous volume. The engorging mechanism, the hydraulics, are not working as well. And that's testosterone dependent as well. So there are good reasons to optimize the testosterone, not beyond optimization, 8, 9, 1100, in terms of the numbers most labs will see, depending on the way they report them out. So there are a lot of different laboratories. So you got to look at the standards there, the norms there. But you want to be towards the top third of whatever that number is through most of your life.
Real quick, so we hear the term, if you don't use it, you'll lose it. So. Mm-hmm. Is this true then with the penis? If they don't use it, they lose, the size as well?
Yeah, it's like going to the gym. If you don't take your penis to the gym, mm-hmm. however that may be,
right.
You start to lose function, you start to lose mass. And, we see all that as we get old. That's why we see older people. Their vertebrae are crumbling, so they're losing vertical height. Mm-hmm. They're gaining horizontal width, because that skin has to go somewhere, mm-hmm. Or they're gaining subcutaneous fat or visceral fat, things like that. And, those are all parts of getting older. So, you see people where mentally they're functioning great, but their body has worn out, mm-hmm. and vice versa. We mm-hmm. see people with bodies working just fine, and they've got some dementia or Alzheimer's or something like that. And, these are the curses of age as we approach our shelf life. Mm-hmm. So with men, we start to see loss of muscle mass. We start to see loss of vertical height as the bone is reabsorbed, and the cushions between the bones, between the vertebrae, mm-hmm. The discs lose water. They're not able to maintain as much fluid, so they're not as bouncy. They're not as inflated. It's like running around on a set of flat tires. And so guys get older, they get bent over, they lose muscle mass. The ligaments that hold the bones in place in the shoulder, in the hips, and other places get stretched out because they no longer have the bulk underneath them to put them on stretch. So things come out of sockets easier. Things break more easily because they're fragile, because they've lost calcium. They're not producing as many red blood cells, although the testosterone will help with red blood cell production. And too much, as you remember, too many red blood cells predisposes you to strokes and heart attacks. So that's what people are afraid of with too much testosterone. Too much testosterone can make you cranky. Too much testosterone can cause male pattern baldness. So there's lots of things that have to be monitored when you're on testosterone replacement. But it does keep you active in the world and in the bedroom. So we get rid of the crankiness and we improve erections. We improve ejaculations, because certainly as we get older, even ejaculatory volume, which is normally average 3 to 5 milliliters. So a cubic centimeter, a cc, a milliliter, an ml, those are the same. It takes 5 of those, whatever they are, to make 1 teaspoon. So the average guy, despite what they would like you to think in pornography, is ejaculating 1 or a little bit under a teaspoon for the majority of their life. And as they get older and the seminal vesicles involute from lack of use, that volume goes down probably 30% or more. And it's hard to produce. So, guys get all shriveled up. They don't have as much volume in the ejaculate. They don't have as many sperm either. So that's, again, a whole nother podcast. So the length of the penis goes down. The width or girth of the penis goes down. The ejaculate goes down. If they're on testosterone and they're giving themselves testosterone shots once or twice a week or whatever it is, or they're using a testosterone gel or cream that's absorbed through the skin, we don't have an oral absorbed testosterone. So no, the gas station pills are pretty worthless. The body gets used to having that extra testosterone. And the adrenals and the testicles being the primary producers of testosterone, they start to involute because they don't have to work as hard. So if we don't put men on something that keeps the testicles enlarged, if they're on testosterone for a long period of time, the testes actually get smaller. They do with age as well, and it's a chicken and an egg thing. Did the testicles get smaller because there was less circulating testosterone, but the testes produce the testosterone, or the other way around? But either way, the testicles seem to involute and get smaller with age, less sensitivity, all those kinds of things. So we approach those by optimizing testosterone, by using pickle tox to improve engorgement, by using P shots, platelet-rich plasma injections, to help the hydraulics function and increase sensitivity and things like that. So there's lots of things we can do to maintain that. And then we take the pickle to the gym, whether you take it to the gym in terms of a vacuum pump, or in terms of masturbation or relations or all those things. They all count towards getting the hydraulics to work. And so there's a lot of things that guys can and should be doing, I think, on a regular basis. Now, that doesn't necessarily address those things unless they're replacing testosterone and possibly thyroid. And there are some supplements that people feel strongly about. Doesn't replace the benefits that one gets when you add testosterone or thyroid, because the people that we screen, both for surgery and in general screening when they come in with complaints of erectile dysfunction, regardless of the age, those are some of the things that we see again and again and again. And thyroid, which isn't well documented in the literature so far, seems to be playing an integral part of that. So we're checking free T3, that's the active form of thyroid. And if it has decreased, as it often does in age, with both men and women, we can bring that up a little bit. We don't want to make the blood pressure go higher. We don't want to make the pulse go higher. We don't want anybody to feel jittery or anxious the way they can if they're hyperthyroid. But a little bit of thyroid, they get perky, their brain works better, their reflexes come back. A lot of good things happen. Their motility through their stomach improves. So there's a lot of good things happening there. So we can fight MANopause or andropause in a similar fashion by helping people get back to more optimal levels of the hormones they had when they were in their late 20s, early 30s.
Talk a little bit about man boobs and the estrogen that gets produced.
So as we get older and we get more peripheral fat, the testosterone that we do have is sometimes converted to estrogen. When we put people on testosterone, we actually often use a blocker, an anastrozole or something similar, that prevents the conversion or accumulation, the conversion of testosterone to estrogen in the peripheral fat. But it does happen, and you'll see it in kids going through puberty, guys going through puberty, or guys as they get older. They can literally have estrogen production in the peripheral fat and get man boobs. Sometimes they'll get glandular tissue, true gynecomastia. Sometimes it's just fat. And you can reverse the hormone and you can lose weight because it tends to be more present with a higher weight. But often it requires a little bit of liposuction or a little bit of glandular excision in the operating room. So both fun surgeries to do. We like to do those because they're very gratifying. You can reduce the skin envelope with energy. You can take out the glandular tissue, particularly if it's someone who has been used anabolic steroids when they were young and they have these rock hard masses of glandular tissue underneath the nipple-areolar complex. And you can contour the fat all the way over into the armpit to give them a nice manly presentation. So you want to have the pectoralis muscle either shown off or appeared to be shown off, depends on how much muscle they have. So the fat you leave is as important as the fat you take. But you can reduce the overhang, the ptosis, as they call it, and get guys out of their training bras and back into their t-shirts or less on the, so they can go parading without a t-shirt and feel better about themselves.
No, it's great. I mean, it is something we do see a lot. And yeah.
Yeah. So, and the important thing for me as a sculptor of the human body is to recognize that the chest is connected to the armpit, is connected to the shoulder, is connected to the upper abdomen. So to blend those so that it looks natural, it looks like they had a good genetic inheritance, they take better care of themselves, and it all looks structurally appropriate. It doesn't look like they've had something done.
Right.
So we hide the insertion sites in the fold of the anterior axillary fold, or if they have a inframammary fold from having man boobs, we'll hide a little 3 or 5 millimeter insertion site there, where hopefully it can't be seen, or inside a little mole, benign a freckle or something like that, or at the edge of the nipple, depending on their ancestry. Sometimes we can hide a little incision in there, and it's hidden because of the little crinkling in the nipple-areolar complex or the coloring of it. So lots of things we can do to sneak in and sneak out again. If we have to make an incision, we'll make it just inside the areola so that there isn't a hard line on the outside that shows that step between the pigmented tissue and the surrounding skin, which tends to be lighter in most people. Depends on the person.
One of the things that we hear a lot with men who are aging is, they're taking, they're optimizing their testosterone. That's the first thing. But many times they're using Viagra or medications like Viagra. And they'll come in, I tried Viagra, it didn't work. And so tell us a little bit more about those medications and what you would recommend if they tried one and it didn't work for them.
So that class of medications, phosphodiesterase 5 inhibitors, was initially developed for treating pulmonary hypertension, interestingly enough. And it worked okay for treating pulmonary hypertension, but the interesting thing that they found in the clinical trials was that people got erections. They got significant erections. So drug companies being what they are, they quickly reversed where they were going with the drug, because why not sell something they can make lots of money on that has more benefit to the greater population? So boner pills were born, and they come in all shapes and sizes, if you will. They have the basic similar components in that they allow the penis to engorge. And then once you get an erection, it doesn't necessarily hold the erection, it just keeps engorging it. So that's why some guys who have the ability to get an erection, but they have venous leak syndrome or something else going on, will still wear a constriction band at the base of the penis, even when they're using Viagra, Cialis, Levitra, and some of the others. All of these pills, as a class, have the same general inner core, and they all work similarly, but the gift wrapping around each of these packages is a little different. And that's why some guys, Viagra works better for them. Some guys, Cialis works better for them. Some guys, Levitra works better for them. And they swear by them. Mm-hmm. The patents have gone off on many of these pills. So you no longer have to pay, street value is tremendous. I mean, $20, $30 for a pill of brand. And some gentlemen feel only the brands work. The generics, in most cases, are overseen and have to have the same amount of active medication. Again, the gift wrapping may be a little different, so the generics may vary from company to company as far as how they work for an individual. And it's important that you take enough, and that's why some of the lozenges and troches and chews and stuff that we see, Viagra may have 100 milligram or 50 or 100 milligram as a standard dose, but a chew might have 18 or 20 or, some small amount. And so the chews, they have the active ingredient, but it's like getting
Is this what you
a small amount.
Is this what you would get in a gas station?
Well, you wouldn't typically get a prescription medication generally in something that you would get at a gas station. Now, they have found it occasionally in gas station pills, but
so what's chew?
So something, and I don't want to call out a particular manufacturer, Blue,
okay,
that has something that you chew on, but it doesn't typically have.
I thought that was just the gas station type ones.
The other ones, the troches and the chewables and the orals, they may get into the system more quickly, so you get a little bit more of a bump more quickly than taking something orally that you have to wait half an hour, 2 hours, whatever, for your GI system to absorb and to have an effect. So you have to plan ahead a little bit. The Viagra tends to be very bitter. If you chew on that one, it's pretty horrible. Cialis is pretty benign. Levitra is somewhere in between. So, certainly the medications that you can absorb through the mucosa and get into your system more quickly have a little bit more of a kick initially, but they may not have as much medication, so they may not last as hard or have as hard an erection. Okay. And now that we're starting to see technologies where we're able to monitor the duration of an erection and the firmness of an erection, we're going to be able to better monitor these things and really put some of these myths to rest. So we're very excited about these new technologies that are coming available. There is, as they say, an app for that.
So talk about the gas station pills.
So
we get that question all the time on our social platforms. And
a lot of the gas station pills have things that anecdotally have helped with improving erections. So the building block for testosterone, for instance, is DHEA, dihydroepiandrosterone. Pronunciations are tough. But DHEA is a building block for estrogen, progesterone, testosterone, a number of the steroid moieties. And DHEA is available over the counter. And if you have the right pathways, and if your body is not getting enough building block, taking a little bit of pharmaceutical grade DHEA, 25, 50 milligrams, something like that, may increase 10, 20, 30% the amount of hormone that you're making on its own. And then there's things like horny goat weed and a number of other things that are supposed to improve erections. They're supposed to cause a little vasodilation. They may cause a little bit of nitric oxide, so production of oxygen, nitric oxide to be produced. So there are a number of pills like that. So they include various beet extracts and things that have been found to improve nitric oxide production. All those things together are great, and they probably do work a little bit. But, the rhinoceros pills and some of the unique things that when we've gone on fun expeditions and gone shopping, and the gas stations and the adult stores and the things that you can get over the counter have no scientific background. And they're not regulated by FDA or anybody who's monitoring how much of any of these things and how much adulterants are put in.
Mm-hmm.
So, I tell people in general, you can play in that sandbox if you want to, but it's a pretty expensive place to play for very little return on your investment. Versus these days, you can hop online. You can get a consultation with a physician in your state who can go over your symptoms, review your history, make sure things are safe, and prescribe you appropriate medications in the privacy of your computer.
That would
for
be
minimal dollars.
RX. You can do that on
RX is certainly
site,
one of those.
RX,
yeah. So we
sell a lot of those.
Yeah, and it's not our site. We don't own the site. We curate the site a little bit, but they have their own people who do that, and there are a number of other sites out there that do that. So shop around, do the sales, and generally, you can get the generics to try for pretty comfortable amount of money. And certainly these days when it takes 1 and 2 months to get in to see your primary care provider or anybody else, unless you have a concierge doc, it's crazy. And half the time you see a physician extender anyway. So, there's pros and cons to that.
What can you tell us about antidepressants? Many times men are prescribed that, and that can affect your erection.
Yeah. So there are a number of disease states, clinical syndromes, things like that we prescribe medications for. So blood pressure, and in particular beta blockers, but sometimes ACE inhibitors, can inhibit erections. Antidepressants of all kinds can decrease erections, but we don't know if it decreases erections more than just being depressed. So there's certainly a double-edged sword there. Diabetes is a small vessel disease which attacks the tiny blood vessels that make the nerve endings work better. So diabetes is a double-edged sword. So if you're running sweet, not only do you not get erections, but you don't feel them. It's just like you don't feel your fingertips in your feet and stuff, those kinds of things if you're an out-of-control diabetic. So there's lots of reasons to try to stay reasonably healthy, eat a well-rounded diet, get enough supplements, get your 6 to 8 hours of sleep a night if you can, and move your body through space at least a little bit every day. Mm-hmm. Those are the things that will keep you relatively young. But yeah, antidepressants, blood pressure medications, diabetes, and now there's some concerns about the medications that we're using to treat some of these autoimmune diseases and things like that. They can all impact erections. They can all impact duration of erection, the amount of semen that you produce, all those kinds of things. And then there's the normal urologic stuff. As prostates get bigger, there's all kinds of implications there. So we have to be careful. Testosterone, I want to repeat again, because we've said this before, does not cause prostate cancer. It may encourage a prostate to enlarge more quickly. It may encourage an indolent prostate cancer to move along and become bigger or more invasive more quickly. So there is a concern about that. But that's something that we can monitor and treat if necessary. And even guys who've had prostate cancer with the right bioidentical hormone doc can go back on testosterone and be very carefully monitored. They can get back on their testosterone, and they can often regain or improve erectile function even after various prostate surgeries. And the prostate surgeries are getting better too. Mm. So, now they've got things little stents that'll hold things open. So guys can pee even if they have prostate. They don't have to get the prostate removed. The transurethral prostatectomies that used to scrape out all the nerves and things like that with prostates are being supplanted with steam. Things that can actually cause the prostate to shrink, if you will, or involute on itself just because of heat. So they're kinder, gentler ways that preserve erectile function, depending on what the issue is. So men that have had heart conditions or on heart medications, can they also take a Viagra? Depends on the medication and the issue. So Viagra tends to lower blood pressure a little bit. And if they're already on blood pressure medications, they have to be careful not to drop their blood pressure and get dizzy, or get dizzy if they stand up suddenly or something like that. So they should at least talk to whoever's prescribing it and say, hey, what do I do? Or start with a smaller amount of medication and gradually increase until they get the best results compared to the least side effects.
I see. So it's not just women that have menopause. Men also go into a state of menopause as well, have fatigue, some of the very similar symptoms that women do. So it's not all us. It's men too.
Oh, no. It's probably men more. So the mental fog, the physical debilitation, all those kinds of things.
So important for them to get to the doctor and tell their doctor all of their symptoms and make sure that they're optimizing their testosterone and taking care of themselves.
Yeah, and find a sympathetic doctor. If you're not getting the answers you want from your doctor or your physician extender, use your feet to vote with. Find one that is more sympathetic, because you may need a young one who's either in tune or an older one that's going through it, so they're more sympathetic. But either way, the information is out there and the treatments are out there. Mm-hmm. It's not something you need to be afraid or ashamed of. It's just aging.
Yep, we do it all day, every day.
We do. So, nobody gets out of this lifetime alive, so you might as well enjoy the time you're here.
That's right. Well, I think we've
covered this segment.
I think we've pretty much covered it. Yeah. I mean, if you have any other questions, though, by all means.
So listen, share, ask questions, all that kind of stuff. We appreciate the questions. We try to answer those individually, or sometimes we'll do another podcast. And thanks for tuning in to another episode of Aesthetic Revolution, the podcast. See you next time.